To recognize Ranking Member Paul for his opening statement.
Ever wonder why we never have shortages of iPhones or computers? What separates the drug industry from the computer or smartphone industries? Computers and smartphones, like drugs, are highly technical and globalized industries, yet there are seldom shortages in any of these industries. However, unlike the computer, automobile, or smartphone industry, the needs addressed by the drug manufacturing industry are often a matter of life and death. This is why the decisions and policymakers and regulators are of utmost importance. Rules and regulations that inhibit the production of drugs will create pain for hospitals and patients. The Food and Drug Administration recently identified a shortage of 120 different drugs. Some of these drugs, such as saline, are necessary for the most basic treatments. These shortages are not a new phenomenon. This has been going on for quite some time. Since 2007, the FDA identified an average of over 100 separate drug shortages per year. In 2011, the FDA identified a whopping 267 drugs in short supply. Despite possessing the most innovative medical industry in the world, the U.S. is unable to maintain a consistent supply of the most crucial medicines. We have to understand why. We understand there's a problem, but we got to understand why this is happening. While many blame these shortages on foreign producers, so-called greedy pharmaceutical companies, and even hospitals, it's no coincidence that the rise in drug shortages correlates with the expanded regulatory reach of the FDA. Drug shortages force doctors to consider rationing medicines and postponing essential procedures and force patients to needlessly suffer. While our nation's hospitals have trouble purchasing the necessary amounts of drugs for cancer patients, heart attack victims, and those in chronic pain, these same hospitals find no such shortages when purchasing computers. Doctors and nurses do not have to cope with a smartphone shortage. There has to be an explanation here. The key difference between these industries and the drug manufacturing industry is obvious. The companies producing computers and smartphones are, by comparison, left to compete with one another with little manipulation from the government, while the FDA places the heavy yoke of regulation on drug manufacturers. This is the key difference. It's the heavy hand of government. Over 40 years ago, Milton Friedman remarked, "If you put the federal government in charge of the Sahara Desert, in 5 years there'd be a shortage of sand." While Friedman was discussing price controls and output restrictions on oil and gas production in Dubai, the same wisdom still holds for drug pricing in our country. The drug industry is one of the most regulated markets in the economy. Output controls, such as FDA's approval procedure for nearly every step of the manufacturing process, increases the cost of production and restrains the adaptability of manufacturers to meet shifting demands. When one company goes out of business, another one can't ramp up without asking permission to make more of a drug. If a drug manufacturer closes, the remaining manufacturers, which must react to increased demand, are forced to seek FDA approval to produce more than the originally approved amount or to produce quicker than the originally approved timeline. This is crazy, and we should stop it. Why does the United States embrace central planning in healthcare? Central planning produced shortages of even the most basic consumer goods in communist countries during the Cold War. There's a famous Soviet quip about a man entering a shop and asking the clerk, "You don't have any meat?" And the clerk says, "No, we're the store that doesn't have any fish." They were used to shortages. It was a common thing. It was a common enough that people joked about not being able to get enough of basic items. We should not tolerate central planning in a capitalist country for the most essential products on the market, further abandoning the principles of basic economics. Medicare price controls, such as requiring drug companies to pay rebates to Medicare if they raise their prices too quickly, create even more barriers to entry, which prevent competitors from arising in the market. Limiting the amount of drug production and producers results in artificially high prices and drug shortages. Americans will be healthier and live longer if their government allows innovators to provide drugs at affordable prices and produce a strong supply. I hope this hearing will identify the regulations that impede the ability of markets to do what they do best, provide for the consumer. I look forward to hearing our witnesses' testimony.
Thank you, Senator Paul.